Ebola, the conflict and compromise. Ebola is a highly infectious and deadly disease. It has killed thousands in Africa and is proven to cross borders, making the virus easily transferable. Since the first outbreak in 1976, scientists have learned a great deal about how to manage, treat, and contain the disease. The Ebola virus mutates quickly and spreads through all animals. Up until recent years, there was no cure or vaccine. There are 5 strains, but one does not affect humans. The Ebola virus is a filovirus. A filovirus is a virus that looks like a string. The 5 strains of Ebola are Ebola Zaire, Ebola Sudan, Typhus virus, and Bundibugyo virus. The 5th, Reston virus, has caused disease in non-human primates, but not in humans. In the early stages of Ebola, most people have flu-like symptoms and severe headaches. Because the symptoms mimic the flu, those who are infected may overlook the seriousness of the disease, which can add to the rate of transmission and death. According to the Centers for Disease Control, or CDC, the initial symptoms of Ebola include muscle cramping, fever, severe headaches, muscle pain, weakness, fatigue, diarrhea, vomiting, and abdominal pain. Later symptoms become more serious and include hemorrhages, rashes, bleeding, and more severe vomiting. Symptoms occur between 2 to 21 days, but most commonly 8 to 10 days. Ebola is very contagious and has proven to easily cross borders, putting people around the globe at risk. Most known cases have occurred in Africa, but cases throughout the world have been confirmed. The first known case occurred in 1976 in Zaire, which affected 318 people, killing 280, or 80% of its victims. Ever since then, there have been 35 other outbreaks, many more severe than the first. From 2000 to 2001, 425 people were infected with Ebola in Uganda. Out of those 425 people, 53%, or 223 people, died. In 2014 to 2016, the most severe outbreak started in Africa. 36 confirmed cases spread to Italy, Mali, Nigeria, Senegal, Spain, the United Kingdom, and the United States. 24 other Ebola confirmed patients were moved to France, Germany, Italy, the Netherlands, the United Kingdom, the United States, Norway, Spain, and Switzerland. An estimated 11,315 people died in that particular outbreak. An affected person can have Ebola for 2 to 21 days without showing symptoms. At this time, they are not contagious. This makes it hard to detect in its initial stages, and when people who are infected travel, they may spread the disease to other parts of the world. In 2014, 2 nurses in Texas were diagnosed with Ebola after treating Thomas Eric Duncan, who started showing symptoms after arriving in Dallas from Liberia. Ebola has proven itself to be very contagious and deadly. In Europe, from 1347 to 1351, the Black Plague was one of the most devastating pandemics in human history, resulting in the deaths of an estimated 75 to 200 million people. The first virus in 1976 was traced back to contaminated needles at a hospital where only 5 syringes were used each day to treat all of the patients. Ebola treatment practices have changed, and scientists and medical professionals are treating this disease differently to lower the chances of it spreading. In 1976, after 22 people had died from the disease, it was recommended patients and medical professionals who treated them be put under strict quarantine and the hospital be closed. There were even limits to commercial airplane landings in traffic in and out of villages. Ultimately, 13 of the 17 staff members at the hospital where the first outbreak took place became affected, and 11, or 80%, died. The decline of the outbreak most likely resulted from changes in the community's behaviors, such as altering traditional burial practices so that people could avoid catching the virus from dead patients. Also, those who treat patients with Ebola take great precautions, such as using protective gear to avoid catching and spreading the disease. Medical personnel began isolating patients with Ebola to help prevent the disease from spreading. The World Health Organization has learned that early detection and treatment are necessary to help prevent the disease from spreading more. While Ebola is the most deadly contagious disease, there are others that must be treated in a similar manner as Ebola to prevent spreading and a possible epidemic. Some of the deadliest contagious diseases by death toll also include HIV, which has caused more than 1.6 million deaths, tuberculosis, 1.3 million deaths, and pneumonia has caused the death of 1.1 million deaths in children under the age of 5. There is no FDA-approved vaccine available for Ebola. The CDC recommends that travelers to an area affected by Ebola make sure to practice careful hygiene by washing their hands with soap and water or an alcohol-based hand sanitizer, and avoid contact with blood and body fluids such as urine, feces, saliva, sweat, and vomit. People should not handle items that may have come in contact with an infected person's blood or body fluids, such as cloths, bedding, needles, and medical equipment. Also, people should avoid funeral or burial rituals that require handling the body of someone who has died from Ebola. People should also avoid contact with bats and non-human primates or blood, fluids, and raw meat prepared from these animals. It is also recommended that travelers avoid facilities in West Africa where Ebola patients are being treated. According to an article in the Washington Post, 4 years after the United States pledged to help the world fight infectious disease epidemics such as Ebola, the Centers for Disease Control and Prevention is dramatically downsizing its epidemic prevention activities in 39 out of 49 countries because money is running out. The Ebola virus continues to pose a threat to regions in Africa, therefore is still a global threat. Through research and technology, the threat of a pandemic is rather low. While the number of new infections is now under control, it is clear that it can reemerge at any given time. According to Trey Brook, owner Comprehensive Emergency Management Associates, medical professionals and emergency management specialists learn from tragedies like Ebola. As they learn from their failures in responding to tragedies, they become more prepared to treat the next attack, pandemic, or natural disaster.
A disaster exercise is not real life, but it's a simulation of real life, and we want people to fail. And the reason why we do it is to figure out what's broken, because we can't fix anything until we identify what the problems are. And that was the compromise. The compromise of people becoming sick and some of them dying, including healthcare workers and other people who had direct contact with these people. Horrible, horrible tragedy. But all of that resulted in learning and being able to adapt and become better prepared for the future. And that is what has happened with medicine and public health and emergency management over dozens of years, over decades, because of those compromises. Every time something really bad happens, it's not just Ebola. We learned a lot from the major tornado that happened in Joplin, Missouri. We learned a lot from the hurricanes, obviously, Puerto Rico, Hurricane Harvey, all the others that have happened in recent years. We learned from Hurricane Katrina. We certainly learned from 9/11. Every time something really, really bad happens, we learn what we did wrong to be prepared in the first place, and we learn how we could have been better when we responded to it in the heat of battle, so to speak. And we learn how we can recover better after the fact.
Vaccines are being researched to eliminate Ebola. Through the outbreaks and tracking how the disease spreads, scientists have learned a lot about how to treat infectious diseases. Through the Ebola outbreak and the loss of thousands in lives, scientists and medical professionals have learned how to appropriately treat the disease and others like it to prevent another global medical crisis using what they have learned through the last Ebola crisis. The world is more prepared to prevent another outbreak that may rival the outbreak of 2016.